These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of, you and I together.
Your life is on the line. You're in need of the latest technology. From inside the Med Flight Chopper over St. Joseph Mercy Ann Arbor, I'm Lila Lazarus, and this is Discover Remarkable.
Real stories of people whose lives were saved, incredible stories at the heart of medicine. You see, St. Joe's is pioneering the use of robotic technology, changing the lives of cardiac patients. One of those patients is Joseph Matt, who discovered remarkable care inside the St. Joseph Mercy Health System.
My grandson's team was short-handed. They were playing and it was back and forth, and they were on a penalty kill, and that was like 2 minutes to go, and I had these real bad chest pains.
As soon as he grabbed his chest and he's rubbing his chest, I'm like, okay, we're going to the hospital.
It took some convincing, but Joe's family got him to the hospital, and doctors determined Joe was having a heart attack.
It was just totally unexpected, just out of nowhere. He'd been healthy up until then. I mean, totally healthy. It was just out of nowhere.
Doctors opened the blockage in an artery in Joe's heart with a stent. A second episode occurred a year later. Then, just months ago, an uncomfortably familiar pain returned.
You know, I didn't believe that I was having a heart attack. I didn't want to believe it.
When he went for the stress test, we more or less thought there's probably just a stent that was out of place again, and he would go in and have the angioplasty and be done. But when they came in and said, we're sending him straight to the hospital, I knew it was more than that.
Hey, Mr. Matt.
Hi.
How you doing?
Good, you?
Good.
Dr. Manak Sood and the cardiology team determined Joe was a perfect candidate for a new procedure being pioneered at St. Joseph Mercy Health System. A robot called the Da Vinci performs heart bypass surgery.
So the two advantages of this operation are we avoid splitting the breastbone and the 3 to 6 months it takes to heal a bone, but also avoiding going on the heart-lung machine. Now, the heart-lung machine in a traditional operation will circulate blood for the patient while the heart is stopped, and will keep the heart stopped for 45 minutes, 60 minutes, hour and a half as needed. Most of the complications from open heart surgery in this setting come from reacting to or going on the heart-lung machine. We can avoid that by doing a beating heart procedure where we never stop the heart using the robot. That's the key, you know, because we take the grief up front, we get all the benefits downstream. So, shorter hospital stay almost by a half. Clearly less blood loss. Our stroke rate, our mortality rates are going to be lower. Across the board, it's a safer operation than going on the heart-lung machine.
Instead of an incision this big, you're making these tinier holes.
It's a different world. It's a different world. It's a couple little stab incisions and then one working port incision that's about 2 inches long. It's a whole different animal. And we're not going through any bone. We're going between the ribs. You know, it's open heart surgery. I don't want to ever play it down because it's still open heart surgery, but the recovery is very comparable to any operation anywhere in the body anymore. And so, you know, you're going to get back to your life quickly.
This is our family when they were just kids.
For 66-year-old Joe, there were some important dates on the calendar. His wife Retta's birthday in March, his grandson's next hockey game, and a wood shop full of unfinished projects.
I have a place out in the barn that I do my woodworking. I make little benches and canes and walking sticks, and I have a table that I built for my son-in-law. I call it a foot locker. Plan on making one for each one of my grandkids. Don't even think about your heart when you're down there. Actually, I feel real good, and I still feel like I'm in the 40s. And having this surgery done this way makes me feel a little bit better about having everything, being able to recover sooner and get back to my life.
How are you?
Hey, guys.
How you doing?
Good.
You all set?
Anytime you face a 4.5, 5 hour surgery, it's just a really, really scary. It's a big procedure, and when they give you all those forms to sign and you see all the side effects that could happen, makes you mortal, makes you know that things could go wrong, so, but knowing that you're in the best hands makes a big difference.
Love you.
Here we go, Miss Hance. This is Lauren Hance, guys. She is a superstar, our senior PA. She and I have done all these operations together.
Joseph Matt's heart bypass surgery is being done at St. Joseph Mercy Health System, where doctors are pioneering the use of robotic surgery for cardiac patients. St. Joe's currently performs more of these procedures than any hospital in Michigan.
This is patient's catheterization. Anything you see in black here is dye within the coronary arteries, so our target vessel is right here. This is the left anterior descending.
So while the cardiac team prepares the operating room, Joe's family begins the long and difficult wait. Joe's wife, Retta, had breast cancer surgery just a few months ago, and now it's her turn to sit anxiously and wait for word.
Could you have gotten through what you went through without him?
Oh, heavens, no. No. So, no, he's takes care of everything, and you don't realize it until you become the caregiver, so he's wonderful. We've been together 45 years.
They were telling me a little earlier that the thing that makes them most comfortable is they feel such a connection to you.
Yeah, I'll tell you, that you get together with these people for a month, out of both of our lives, meet each other out of nowhere. You stick your hands in their chest and, say goodbye to them a month later. It's kind of a strange relationship. It's incredibly intimate, yet, after 30 days you say goodbye and you don't see them again, so very strange. This is our target vessel right here, and there's a blockage right there. And on a different view, there's even, in fact, this patient has had a stent in the past, and the stent has failed. And you can see the shadow of the stent right here. See that little elbow right there?
Yeah.
That's a previously placed stent. And he's got a blockage right at the end of the stent, about 90%. We're very unusual in that we've got a dedicated core team in every aspect of our patient's care, starting from preoperatively, intraoperatively, ICU, and on our step-down unit. That's what we do every day. That's what these people do every single day, and standardization is the key to success in this specialty, and we've got an amazing team.
It's just mind-boggling. It's just sitting here reflecting and all the things that we've done, all the things we do, all the things we want to do, and hoping that he's okay back there. So I think he'll be fine.
He's in good hands.
He is. He's in the right place.
With the precision of the Da Vinci robot, an artery is taken from Joe's chest. It'll be used to bypass his blocked artery.
The robotic portion of the operation, because his chest cavity is a decent size, should be relatively straightforward. But when we convert to actually do the anastomosis, is going to be a challenge in making our incision just the right size and hoping our retractor is deep enough to spread his ribs enough so I can get a look at it. But the majority of the operation is done with cameras, so that visualization is actually better than it would be looking at it directly.
So in some ways, the robot has better eyes and better hands than you do.
Ouch. Ouch. Yeah, in some ways, I guess. The reality of it is the robot's not doing anything by itself, right? It's driven by the surgeon who's controlling it from across the room, so it's an extension of what we can do. And you're right, it's more precise in certain ways, and finer movements is needed. And so, yeah, it augments what we can do surgically. The robot's great in terms of its 3D visualization, and that's the beauty of sitting in a console. When you're looking at a screen, standing in the operating room, you're seeing it on a flat screen. I've got 3D visualization in my console.
Meanwhile, Joe's whole family is waiting.
How much does this guy mean to you? Oh, he means a lot. He keeps the family together, too. I mean, he's there for every one of us.
Standing there in your operating room, I marveled looking at a human heart.
I don't think I'll ever take that for granted. It is such a unique feeling. I feel blessed to be able to hold somebody's heart in my hand, and I've always, maybe I'm glorifying it too much, but the soul, the heart, you can't live without a heart.
I like the way that went. That's nice. Got a good look at it, even for a thick guy. It's great.
Often the patients will, in the waiting area, want to shake your hand because they know you've held their wife's heart or their husband's heart, and that's their contact with their spouse on a level that most people can't imagine. It's a privilege.
Everything went fine. He tolerated it fine. Anatomy was very favorable. Everything lined up perfectly.
When you walk out of the operating room, the family looks very stressed, and you tell them everything went fine. And you see this, it's palpable. They let out a sigh, and there's a sense of relief, and they grab your hand and say thank you. And there's nothing that's going to compare to that.
My name's Dr. Sid. I'm one of the heart surgeons here at St. Joe's, and I'd like to formally welcome to Healthy Hearts 101.
Twice a month, Dr. Sood takes time out of his busy schedule to present a program for elementary school students. It's called Healthy Hearts 101, a stunningly graphic presentation of the dangers of heart disease.
I would argue that this process has already been going on by the time you're 75. You may already be having bypass surgery by then. In fact, this process called atherosclerosis starts at the age of 6 years old.
Healthy Hearts is our chance to impact heart disease on a different level. I've got heart disease in my family. I work with heart disease. I see death and dying from heart disease every day. If we can impact some of these young adults early on, and if we can save a few of them from dying from heart disease, then it's totally worth it.
Take your gloved hand and pump on that. The one with your glove.
Oh, okay.
Yep. And blow those out.
I think part of being a doctor is doing what you do in the hospital. Part of it's being a citizen in the community, putting back something into the system that got you here and keeps you here. I obviously love kids, and so if we can work with kids and impact them, and they're going to go home and talk to their parents, so we're getting to the parents indirectly. So you're affecting a few families each time you do this.
Dr. Sood understands the pain of losing a loved one to heart disease. His father died from a sudden heart attack just 5 years ago.
I think, if anything, I have a whole lot more respect for open heart surgery since my dad passed away. Mostly that I feel very blessed that we get a chance to fix these people.
Morning. How you doing this morning? Did a good job, huh? Everybody did. Yeah, the operation went really well.
These people have heart disease and they had symptoms, or they've had a positive stress test. We've made a diagnosis on them. So every time I approach a patient now, especially an elderly male, I say, this is my dad. I could fix him. But we get to fix these people, and we get to send them back to their sons, and get to have them spend another Christmas with their families. So it's become even more rewarding since my dad passed away, because these people are going to get to see their kids some more.
And Sood says it's his own family. Wife Lucienne, daughters Serena and Anjali, and sons Ian and Evan, who keep him grounded.
All right. So I'm saving it.
Now, it's clear to your family that you're just Dad, the guy who beats them at ping pong sometimes.
You don't have a backhand, Ian. What the heck? What the heck?
So they just describe you as just Dad.
That's perfect. You have to have you have to be a little serious and professional here at work, obviously, and you don't want to be like that at home. They don't really care if you operated all day, in all due respect, and they don't really care if you're doing an emergency at night or if you've got an ICU patient taking up their time. What they're going to remember in this whole thing is the guy who was sitting in the bleachers cheering the loudest, or the first guy to give him a high five when he came off the court, or the guy sitting in the front row for your school play or your first communion. That's what they're going to remember. They're not going to remember the surgeon. There's 3 roles for every guy like me. You're a surgeon, you're a husband, and you're a father. And I could be replaced here tomorrow as a surgeon. I fully realize that. But they have one dad, and that has to be priority one. So the fact that they can say he's a dad, not a doctor first, that tells me I'm doing something right.
He's not as serious as he normally is at home, so he's a little bit goofier. I mean, not every dad saves lives for other people, so it's kind of cool having a dad who can do that.
I try to think unselfishly, because even though he can't be with me right now, he's going out there saving another person's life.
Yeah, you gotta be kind of understanding with that, because he works crazy hours. He could be called in at any time, and it's just as upsetting for him as it is for us, so we learn to live with it. Almost every night we're able to sit down like all together as a family for dinner and just we talk about our day, and that's my favorite part of the day, actually. It's really nice.
What do you want them to know about you?
I'll tell you what I wanted to know about me point blank. There's 4 reasons I wake up every morning, and this is great, and this is a great specialty, and I love helping people, but there's 4 reasons I wake up every morning, and you've met them.
John Burkhart is another patient whose heart has been touched by the skill of Dr. Sood, the St. Joe's cardiac team, and the precision of the Da Vinci robot. John's a university professor who loves to garden and is devoted to his wife Janice and his son John. He discovered one day that the future can change in an instant.
I was playing basketball one day with my son and daughter-in-law and felt some pressure in the chest and talked with John about it, he's a physician, and it didn't seem to be that serious. And then a week or so later, I was walking to a U of M football game, and I kept saying to him, "Slow down." And he said, "You know, you should have that checked out." So
Did you think there was anything wrong with your heart?
Not really. I mean, I think there's a part in all of us that thinks we're not getting older, and it was just something temporary and not too serious. And so went for some tests, and every point along the way I thought, you know, they're just going to tell me to go home and eat better and exercise more. But the opposite happened. I kept getting moved up the system until I finally learned I needed surgery.
John's first call was to his wife Janice.
Janice and I are great friends, and she had experienced cancer earlier in our life, and I remember the conversations with the doctor around that. The kind of feeling of disbelief that this is a conversation that involves someone else. I know enough about what goes on in this field that I knew that not every result was a good one.
John's blockage was in a single artery of the heart, making him a good candidate for Da Vinci surgery.
You know, it's one thing to say, it's a gee whiz, this is incredible, tell me how that works. That's all very exciting. But what really matters is what happens after the surgery. And, you know, the first week is difficult. But then you start to look forward to the opportunity to get back doing the things you love to do, realizing that you're not nursing the trauma of having your chest cut open, that scar that many people carry around for the rest of their lives isn't there. Those are the kinds of benefits. It's pretty hard, I think, for most lay people to fully understand how someone in another room can be working on you with that kind of precision. That's Star Wars. But what you can understand is you're going to feel better sooner. You're going to be able to resume the things in your life that you most love. That the pain is going to be less in the long term. Those are the things that I think make a difference.
Hello, everyone.
That difference allowed John to get back to the classroom and to research projects with his graduate students at the University of Michigan.
I was back teaching about 3 weeks after surgery. I was excited to be back in the classroom. I was kind of excited to be able to show all of them, hey, I did this, I'm back.
I would like to say about Dr. Sood that it's a scary time, but he made me feel so confident in him that I wasn't frightened. And the people at St. Joe's offered John the very best of care. St. Joe's Hospital is a place of remarkable medicine.
I started gardening when she was going through chemo, and now it's a big part of my life.
This all happened in November, late October and November. And for those of us who live in Michigan, it's the time in which you're looking for bulbs on sale, right? And you're putting them in the ground. And there's really no greater act of faith than planting bulbs for the next spring. And as I sit here today in March, I can't wait to see what's going to come up. And I think that the last weekend before the surgery, I remember planting. Not absolutely certain that I was going to see that,
but knowing that someone would, and that meant a lot.
And for Joseph Matt, he was released from the hospital just 72 hours after surgery. Within a few days, he was back doing the things he loves.
I can go back out in my barn, work in my barn, do my wood carvings. I have that more energy now to do the things that I wanted.
Like watching his grandson's hockey games.
We went last Saturday, went to one. It was pretty exciting to not have that problem anymore. It's always something special to see your grandson play.
Happy birthday to you.
And the best, the whole family celebrating Retta's birthday.
For my wife's birthday, it was special just to be together with my wife for 44 years. Being married 44 years, we've been together for around 50. And to have the family together, and it's very special to just get together and enjoy ourselves.
I guess when you get our age, birthdays are always special because you're looking for the next one. But anytime that you have a chance to have your family together to celebrate something special like birthdays, and to know that Joe's well and we're all healthy and happy, you can't put words in it.
That's a good one. Yeah. Pretty cool, ain't it?
So that's the end of the show, but really it's just the beginning. Because this robotic technology is moving into every facet of medicine. And St. Joe's is leading the way, actually teaching other physicians around the country about the robot's innovative uses. From more advanced heart valve replacement to less invasive hysterectomies for women, when it comes to advanced technology and patient care, St. Joe's is the place to discover remarkable medicine. I'm Lila Lazarus. Thanks for watching. Hope you'll tune in next time for another edition of Discover Remarkable.